Hello, everyone. My name is Alexis Connolly, and this is a systematic review about vitamin D for diabetes prevention in obese adults. Vitamin D, or in its active form, serum 25 OHD, has become a major cause for concern in the lives of individuals struggling with being overweight and obese and their risk for disease development. Although many try to stay healthy through diet and exercise, vitamin D deficiencies could lead to precursors of type 2 diabetes. The purpose of this systematic review was to determine what effect vitamin D has on insulin sensitivity and insulin resistance in obese individuals at risk for diabetes. The data sources that were included in this review include Gale, Wiley Online Library, and Scopus. The studies were required to be no more than 10 years old, with the full text online, and be listed as a scholarly article or peer review. The participant criteria was created to focus on adults that were obese and had not had a diagnosis of type 2 diabetes. The interventions for the study chosen were all of vitamin D, but at different dosage amounts. This included 1,200 IU per day, 4,000 IU per day, and an injection of 240,000 IU as a single dose. The results of the systematic review indicated that vitamin D supplementation decreased the severity of vitamin D deficiency and improved insulin sensitivity in all but one study. Limitations recognized in the process of the study included the small sample size of each study, the fact that the healthy baseline was slightly better than the researchers had wanted based on criteria, and that there were very high drop rates for each study before the follow-up exams. Vitamin D plays an important role in the health and development of teeth and the skeletal system and muscle function by maintaining the mineral balance in the body. It is essential for calcium utilization and is also considered an important component in the production and regulation of insulin secretions in cases where there is increased demand, such as with obesity. When it is obtained through the diet, vitamin D is absorbed by the micelles and intestinal cells within the duodenum and proximal jejunum with the help of bile. Chylomicrons transport vitamin D2 to organ systems all over the body, while vitamin D binding protein transports vitamin D3 through the blood after absorption into the skin. Vitamin D2 and D3 in its digestive form is converted to its active form in the liver and stored as 25-OHD in the blood and the adipose tissue. Vitamin D stored in adipose tissue is not as bioavailable and takes longer than vitamin D stored in the blood or the liver. This information is important considering the fact that in people that are overweight or obese, vitamin D is more likely to be stored in the adipose tissue, which means it has less bioavailability. The PICO statement for this systematic review raises the question, in non-diabetic adults ages greater than 19 years of age, suffering from obesity with a BMI over 30, what effect does vitamin D have on insulin sensitivity and insulin resistance, and therefore the risk related to developing type 2 diabetes compared to a placebo? The methodology used to research these articles includes specific eligibility criteria sources, search terms, study selection, data collection process, and data items. The eligibility criteria, as stated before, were no older than 10 years, and everything was required to be in the English language. No country was specified. My information sources included Scopus, ProQuest, a Wiley online library, Gale, PubMed, and Academic OneFile. Several of these were omitted after the review was performed. The search criteria was one statement, which was vitamin D supplementation and insulin sensitivity in obese non-diabetic adults. The inclusion for the study selection was anything that focused on information on vitamin D's relation to insulin sensitivity. The exclusions were studies on subjects with diabetes, adolescents or children, and other vitamin or mineral interventions. The data collection process involved keeping the objective clear and concise with a set of specific search terms, population criteria, and specified outcomes. The data items were developed from the collection process with outcomes measured through OGIS, or oral glucose insulin sensitivity, ISI, insulin sensitivity index, and oral glucose test, OGTT. For the study selection, 16 studies were screened and assessed for eligibility, credibility, and relation to the subject at hand. Only 4 studies were included in the review. Certain studies were excluded because they focused on adolescent or children, diabetics, or other populations with underlying conditions related to obesity, such as cardiovascular disease or kidney disease. Others were excluded because they failed to meet the main outcome of any effect on insulin sensitivity or insulin resistance from vitamin D supplementation. The interventions criteria for the study was open to any form of vitamin D supplementation. This includes oral intake through food or vitamin supplementation, intravenous nutrition support, or injection. The study characteristics for this first study states that the study size was 50 subjects. The PICO was to perform a well-designed randomized placebo-controlled trial in healthy but overweight and obese individuals as they are, or average insulin resistant and have chronic low-grade inflammation. The follow-up period was 16 weeks for this study, and they indicated that the authors declared they had no competing interests. The study conducted under J. Nagpal was performed using 71 subjects. The PICO was to determine the short-term effect of vitamin D3 supplementation on insulin sensitivity in apparently healthy, middle-aged, centrally obese men. The follow-up period was 6 weeks. The authors also indicated that they had nothing to declare on risk or bias or conflicts. In this next study, conducted under S.S. Harris, it was performed using 89 subjects. The PICO was to determine whether vitamin D supplementation improves insulin secretion, insulin sensitivity, and glycemia in African Americans with prediabetes or early diabetes. The trial took place in 12 weeks, and the authors declared that they had no conflict of interest relevant to the manuscript. The study, conducted under Mirjam N. Osterwerf, was performed using 130 subjects. The PICO was to examine the effect of vitamin D supplementation on insulin sensitivity with beta cell function in overweight, vitamin D deficient non-Western immigrants at high risk of diabetes. The follow-up period was 16 weeks. The authors for this study also indicated that they had no conflicts of interest. Based on the information provided from each of the articles, all of the authors had nothing to declare, and they had no competing interests relevant to the research conducted. In the results for the study conducted by D. Corton B., which is currently going on, there is no permanent results that have been notified. However, based on what has been completed, they have found that vitamin D supplementation counteracts the harmful effect of advanced glycation products used in the increased development of insulin resistance and therefore type 2 diabetes. The intervention for the study conducted by J. Nagpal produced results showing the intervention group that started with a baseline mean of 35 of active vitamin D and had gone up to 36.5 of active vitamin D, with the placebo group that started at 36 of active vitamin D and had gone down by 30 of the active vitamin D. The results of the OGIS, or oral glucose insulin sensitivity test, showed that the insulin sensitivity of the intervention group that had decreased to 412 and the control placebo group had increased to 434. The intervention for the study conducted by S.S. Harris produced results showing the intervention group with vitamin D levels at 81.1 and the placebo group with vitamin D levels at 37.4. The results of the MISI, or risk related to morbidity based on insulin sensitivity, decreased by 4% in the intervention group and increased by 12% in the placebo group. The intervention for the study conducted by Mirjam N. Osterwerf produced results showing the intervention group with vitamin D concentrations that increased from 25 to 58, and the placebo group with vitamin D concentrations that stayed between 22 to 24, which was close to their baseline. The results for the insulin sensitivity test showed that there was no effect of vitamin D supplementation on insulin sensitivity. Each of these articles selected provided information on connection between vitamin D, insulin resistance, and sensitivity in obesity in adults. For the first article by Descorton B., they conducted a positive quality randomized placebo-controlled trial in order to assess the effect of the supplementation of 4,000 IU daily vitamin D use versus the placebo on decreasing insulin resistance in 50 overweight or obese adults with a mean age of 39 years old during a 16-week trial period. All tests considered statistically significant have values less than 0.05. The results were not finite because the investigation is ongoing. However, this study was relevant to the review due to the information obtained during experimentation on the advanced glycation process and its involvement in the development of type 2 diabetes. For the study conducted under J. Nagpal in 2008, a neutral quality double-blind randomized placebo-controlled trial was conducted in order to assess the effect of a single dose of 240,000 IU vitamin D3 supplementation, which is given as an injection, versus the placebo on insulin sensitivity in 71 healthy and centrally obese adult men with the age of 35 years old during a 6-week trial period. The results indicated that there was an increase in oral glucose insulin sensitivity with vitamin D supplementation by per protocol analysis with p-value of 0.038 and the intention to treat analysis with a p-value of 0.055. This was relevant to this review because the researchers concluded that vitamin D3 supplementation improve postprandial insulin sensitivity in healthy men with insulin resistance and central obesity. For the study conducted under S.S. Harris in 2012, a positive quality randomized placebo-controlled trial assessed the effect of 4,000 IU daily vitamin D3 supplementation versus placebo on insulin secretion and insulin sensitivity on 89 obese or overweight adult African American with a mean age of 56 years old during a 12-week trial period. The results showed that in intervention group insulin sensitivity decreased by 4% and insulin secretions increased by 12%. In the placebo group, insulin sensitivity increased by 12% and insulin secretions increased by 2%. This was relevant to the review because the researchers concluded that supplementation of 4,000 IU per day of vitamin D had divergent effects on insulin secretion and sensitivity. For the study conducted under Osterwerf in 2014, a negative quality randomized placebo-controlled trial assessed the effect of 1,200 IU daily vitamin D supplementation versus placebo on decreasing insulin resistance on 130 overweight non-Western immigrants at high risk for diabetes and at a mean age of 42 years of age. Based on the results obtained, there was no effect on insulin sensitivity. This study was relevant to the review because it showed that 1,200 IU per day of vitamin D was not sufficient at affecting insulin sensitivity in obese adults. The implications of this study stems from the conclusive evidence reviewed from each article. These studies show that vitamin D could possibly be used as a preventative supplement in obese adults. Healthcare professionals could use serum 25 OHD concentrations to determine the occurrence of deficiency in obese adults. It should be noted that vitamin D deficiencies in obese adults could be a precursor to type 2 diabetes. This also pertains to obese adults living in cold weather climates. This could be a huge factor in their risk for diabetes as well. Based on the results of this review, the preferred supplementation for obese adults at risk for type 2 diabetes should be 4,000 IU per day of vitamin D. The conclusion for the study and overall research examination states that vitamin D supplementation of 4,000 IU or greater per day was sufficient in increasing insulin sensitivity and decreasing insulin resistance in individuals that were obese and at risk for type 2 diabetes. The funding for the article under the Cordon B was funded by the authors personally. The funding for J. Nekpal's study was funded by the Indian Council of Medical Research of New Delhi, India. The funding for the article under S.S. Harris was funded by the Clinical Research Grant of the American Diabetes Association and by Jean Mayer of the U.S. Department of Agriculture and Human Nutrition Research Center on Aging at Tufts University. And the M.M. Osterwerf article was funded under Merck & Co. for the analysis of serum 25 OHD concentrations in the longitudinal aging study of Amsterdam. Thank you, and I hope you've enjoyed this presentation.